we get started, I'll just hang on to her
Oh yeah, just to introduce her. Okay. All right, so we might as well get into it, Kathy.
she's very feisty. Yeah.
All right. Hello and welcome to another edition of Money Bit Mondays. My name is Tanisha Comers. I am a certified financial planner and the founder and president of KFLA, Canada's first financial literacy agency. Today we happen to be meeting with Kathy Mendham, who is she founded the local advisory on health planning. So there's not a lot of people doing this today, but she comes from a background of a bachelor's of science in physical therapy, followed by an MBA, followed by government experience consulting with health organizations. In fact, she mentioned she was involved with HealthLink, which I think a lot of people are familiar with. Isn't that right, Kathy?
Yes, HealthLink. Yeah.
Awesome. And then so today, part of the reason that I wanted to bring you on is we're talking about long-term care. And basically how can Canadians prepare for their own critter care. You had a cat in your hands. So part of the reason we have these critters, you have a cat and a dog. Sorry?
I had to put her down so she didn't bite me.
Yeah, no kidding. So how old is your kitten?
Well, we just got her. We call her our COVID kitten. So she's about 3 months old, and everybody's working from home, and we needed a little bit of a pick me up in the house here, and gives me a little distraction and a break from my work. So we got a little kitten, and she's a good match with our dog, and so now we have a dog and a cat.
That's wonderful. Funny story. The reason that we're meeting with both critters is that I happen to have my bird here because I also went and got a pet during COVID. So this little creature is like maybe 2.5 months here with me. Okay, so what do you have for us today? I know part of what we were initially going to talk about was the military reports that everybody's kind of heard about through this whole COVID thing, speaking of, in the long-term care homes.
Yeah.
Tell me more.
Well, yes, I'd love to tell you more about that. So as most people have heard in the news, a few long-term care centers had to have the military come in and actually take over care. Those were a couple of long-term care centers in Ontario.
Mm-hmm.
But even here in Calgary, there was lots of news and lots of media reporting how we had some very serious and tragic infection rates and deaths in our long-term care centers with this COVID pandemic. And it's really highlighted the challenges that part of the system has in long-term care, and the specific issues that they have always faced, but really came through as a crisis during the pandemic, which is primarily the fact that most of their staff, their caregiving staff, their cooking staff, their cleaning staff, they tend to be paid as casual and part-time employees. Mm-hmm. And I'm sure it's a cost reason, they don't have to pay benefits, or it's less expensive for these companies. And so because of that, what has happened is it was just a perfect storm for sharing the virus around from one facility to a next. And then on top of that, in the long-term care centers, obviously you've got the most vulnerable seniors. So there's sort of 3 levels of care for seniors. There's independent living, which is where seniors are generally fairly healthy and they're managing well on their own. They fared really well over the COVID pandemic.
We're talking about a facility still where people are living in as you're saying, an independent living center.
Yeah, well, there's sort of the 3 levels of care. So there's independent living, there's assisted living, and then there's long-term care. And so a lot of people don't really know what long-term care means, but it's essentially nursing home. And that's the term that most people are familiar with. And so those are the seniors that are they're frail, they're older, they have more complex medical conditions, they're living in fairly tight proximity with each other. And so that scenario, in addition to a very, very aggressive virus, very contagious virus, and the fact that the staff are moving amongst different places, it ended up that a few facilities just had a really challenging situation with COVID. A lot of seniors passed away, unfortunately, and they just didn't manage it very well.
Effectively, the issues that we're coming out with is it's systemic, right? That this is something that was kind of, I mean, you're mentioning that it's effectively a perfect storm. You mentioned all of these different elements. So that the care workers are all part-time staff, they're all traveling from home to home, they have like 6 different jobs, therefore 6 different environments. You have a tightly packed environment to begin with. You have individuals who are already I suppose, what's the word,
Compromised.
vulnerable.
Yeah, it really showed who wasn't managing well.
Hmm.
And, there is a bit of bad luck involved. The virus got into the building and it spread like wildfire.
Yeah.
But, they didn't lock it down. They didn't have tight enough procedures for isolation. And, and that's what happened down east where the military had to come in. These facilities simply did not have enough healthy staff to come in and provide the level of care that needed to be provided. And the outcome was quite awful. And we've got a pretty passive dog and she likes the cat. So it's the cat that's super aggressive.
Yeah, not total chaos, hey?
Yeah, exactly.
So let's go back a little bit to that. What is long-term care? So you said there's 3 levels. The first level being the independent living,
Mhm.
the second level being the assisted living. So
Mhm.
how do you define, and then the third level being like the nursing homes, which is where the most vulnerable are. So
Yeah.
what's the assisted living? That's kind of that middle ground.
Assisted living is in the middle. And so that's for seniors that they may not be faring that well at home anymore. Maybe they're getting a significant amount of home care and they need home care repeatedly over the course of the day. And those are the seniors that will tend to move into assisted living. So they have access to nurses 24/7. They don't really need them all of the time, but they need them on an unscheduled basis. So maybe, a little bit in the morning, a little bit in the afternoon, a little bit in the evening. And so assisted living is one step up from independent in terms of you're getting your meals, your activities, and all that socialization, but you're also having a greater access to nurses. Whereas long-term care, those nurses are, actually seeing you 24/7. You're having a significant amount of nursing support.
So can you give me an example of somebody like or a client that you've worked with that would fit into each one of those categories?
Oh, sure. Like lots of clients. So we've got lots of independent living seniors that choose to move into that lifestyle. It's really more of a lifestyle decision. They might be living at home and they're alone. And so they're
Yeah.
lonely and they're getting isolated. Their family might not be nearby. Perhaps they're not driving anymore. Programming. It can be just really lovely. It's kind of like being on a cruise ship, but not on a ship. Your housekeeping's taken care of, your meals are all taken care of.
Gotcha.
That's in the private sector. There's also independent living for lower income seniors. Well, it's subsidized, so it's really through the non-governmental sector. It's not really public health so much as it is
Okay.
through charities and foundations.
Okay.
If you need nursing, it's either coming in from outside through home care, much like you would get if you stayed in your home, or
Gotcha.
some independent living buildings also have assisted living, and they may even also have long-term care within them. And so the nurses are on site and can provide support as needed. But most independent living seniors don't require very much nursing support.
At what age do people really start thinking about moving into an independent living facility?
That's a great question. I would say around 80,
Okay.
around 80. Yeah, and it's
Sounds
usually,
like my grandma.
yeah, they're usually because they're just sort of like not doing great at home anymore, or they just perhaps, like I said, want more of that social environment. So I'd say 80 would be an average age for independent living. 85 is an average age for assisted living, and 90 is probably an average age for long-term care. That kind of makes it easy.
That
Nice.
does make it really easy.
Cute, cute, cute.
So what about you? What's your cat's name?
Cat is Margot. Dog is
Marco.
Molly. Molly and
Marco.
Margot.
Cute. The independent living, it seems basically like somebody who is tired of taking care of themselves or taking care of all of the details. And as you're saying, cruise ship, but with maybe some medical help if you need it. Uh, and then the assisted living is okay, at this point, you probably need an extra hand here and there, maybe some help with your meds, maybe like a nurse visit once or twice a day, possibly, just to, really get you going. And then lastly is okay, now at this point, you're really under constant care. You need a nurse around all the time
Yeah.
just to make sure that you're comfortable and healthy.
There's also sort of three means of paying for it. So that independent living senior, they either pay privately out of pocket, or if they fit the low income threshold, they can be subsidized and move into a subsidized low income seniors building. And so those are the two options to paying for independent living. You'd probably start around $2,000 a month would be about the lowest price for a suite for a senior in independent living, and it goes up from there. You can pay $6, $7, $8,000 a month for independent living. You can have a studio suite all the way through to a two-bedroom or a two-bedroom with den. In the subsidized independent living, it's a really interesting model. It's called rent geared to income. And so what happens is they determine how much your annual income is. And what they do is look at the notice of assessment that you get from the government, your line 150. So you have to be doing your tax returns. And then you get your notice of assessment. So if you are below the threshold, which is around $30,000, depending if you're single or a couple,
Right.
it kind of varies from there. If you're below that income threshold, then you pay a percentage of your income. So if
Gotcha.
your annual income is only $10,000 a year, you're paying just a percentage of that. If your income is closer to the threshold, closer to 30, you're paying a percentage of that. And so it's really much on a sliding scale. And once you have an annual income about 30,000, it kind of is the same as paying for a private pay independent building. So
Right.
it kind of balances out at that point.
You've also mentioned, though, that even the assisted living and the long-term care facilities also cost, whether they're private or public. Can you tell me more about that?
That's true. And a lot of people think that if they're going into publicly funded care, that
Yeah.
it's free, and it's not. So assisted living, you can either pay privately or you can go into the public system. Privately, the prices range from about 3,500 and up. In the public system, it's a flat rate. It's always approximately $2,100 a month, but you get a very regimented thing. You get a studio suite, and you get that sort of level of care that you need, but it's very standardized across all the public buildings. But you know what? $2,100 a month is still quite a lot for some seniors. And if there's a couple and they both need to be in care, that's $4,200 a month. So
I was going to say that's
yeah.
actually a pretty steep cost. Most people, especially lower income individuals who are relying on public
Mhm.
sector, in all honesty, over a decade of looking at people's plans,
Mhm.
many people are relying on the government to care for their long-term care, to take care of
Mhm.
this,
Mhm.
and then they're only planning for their own expenses, perhaps $3,000 a month or something on the lower side. Somewhere between 2 and 3 would be, I'd say, like a relatively skinny retirement budget. So
Mhm.
to imagine that almost all of that would go directly to public long-term care really limits where the money is going to go.
It would. And what's really interesting is if you can afford to pay that $2,100, you have to. And so they take the money out of your benefits. They take it out of your old age security and out of your CPP directly. You look at long-term care, 99% of long-term care is provided publicly, and
Yeah.
that's about the same price. It's around $2,100 a month, give or take, if you have a shared room or not a shared room. But again, there's still that cost. There are some private pay long-term care facilities, very few, and they are usually around $8,000 a month. So they're pretty expensive.
You have to effectively pay no matter what this 2,100, and that's per person, not for the couple, which is important.
Mhm.
Yeah, I mean, I still think that that's really surprising because a lot of people really do, as I said, tell me, I don't need to plan for this. The government will take care of it. It's not my expense.
What's the bird's name?
The bird's name is Harley.
Oh, do you have a Harley?
Um, no, it's like she's got a 50-50 chest, like half of it's green and half of it's yellow. So like Harley for Harlequin.
Oh,
We're talking about facilities. How does this compare to staying at home? Because at the end of the day, I know a lot of people they'd love to do that. That's
mhm,
becoming more and more common. You mentioned that it's a COVID trend, especially. And so I'd
mhm.
love to hear a little bit more about that.
Well, it's such a great question, Tanisha, because it costs a lot to stay home too,
Hmm.
surprisingly. So, seeing this day and age, you really can't expect that your kids are necessarily going to take care of you or your neighbor's going to take care of you. There's a lot of seniors that don't have families or their family lives elsewhere. So, the cost of staying at home, you have to factor in a lot of those supports that you would be getting in a care facility. And that's why sometimes people move. It just becomes too costly at home or too complicated. But if you're staying home, you're at some point going to need some nursing support probably. So you're going to need some home care. There is public home care, which is free, but it only provides limited hours of support. A lot of people end up having to go for private home care to top it up. And that
Yeah.
costs about $35 an hour. So the longer you stay home, the more nursing care you need, the higher that bill starts to climb.
Right.
Just as a comparison, if you had 24/7 private home care, it's about $17,000 a month. So
Yeah.
that's actually a lot more than if you were going into one of these facilities, right? So it
Yeah.
kind of balances out. We always talk about the tipping point. At what point does it make sense to choose one over the other? So there's the cost of home care. There's bringing having meals delivered into your house, having foot care brought into your house, or dental hygienist services, or companion support, so that you're not isolated and lonely.
So one of the things that I know you mentioned last time, because I want to go back to COVID, is that a lot of people are really getting frustrated by the limitations that long-term care has, you know, I guess the limitations that come with long-term care,
Mhm.
through this whole COVID thing, as well as just, the general fear of being in long-term care now.
Yeah,
We've seen
yeah.
the reports for one, and for two, we've talked about this super high death rate, which is just frankly frightening. So
Yeah.
how are people, what do you suggest?
Well, you know what? We're seeing a lot of people choosing to stay home longer than they might otherwise, or bringing their loved ones home from long term care. So, I guess the thing to share here is that one of the risks, like you mentioned, is that maybe their infection rate might be higher. The infection risk might be higher in that group setting. I would say it has demonstrated to be that way. I think that will improve over time. I think these facilities have learned a lot about being more proactive about their infection control and staffing. That's going to change as we move forward. So I think that risk of catching the virus is probably less of an issue than it has been for this first wave of COVID.
Mhm.
But what people are really worried about is the fact that they can't leave or their family can't come in to see them. So if
Yeah.
there is an outbreak and if we have a second round of COVID, everything gets locked down again and they can't visit their family. They can't see their family, whether they're the senior in the facility or the kids outside. It's really terrifying to think that they can't visit with each other. And we are having a lot of families reach out to us and say, how do we bring our loved one home? My mom is at the end of her life. Maybe she only has 4 to 6 months left. I want to spend it with her. I can't
Hmm.
visit more than once a week. That's not acceptable. So we are helping families organize all the supplies and equipment and care that they need to bring their loved one home.
This is where planning comes in is, if you know what your options are, if you know how much it costs, if you know what you want to do, then you can literally pull off anything, but you do need to be a bit planned.
Yeah.
So one of the things that I think is important to mention that you told me last time is these reports that you're pulling together for people are like 40 pages long. So
They're
if somebody is
complicated.
thinking, yeah, so if somebody is thinking of doing this on their own, FYI, there's actually a lot of details. There's a lot of different moving pieces. You're talking about like not only healthcare, but like, the equipment
Equipment,
involved.
yeah,
Yeah,
yeah.
exactly.
How transport, equipment,
Yeah.
food and everything.
Yeah.
And really importantly, Tanisha, care of the caregiver. You don't want to go into this lightly. If you're the spouse or the child and you're going to take on this responsibility, yes, you can certainly do it. You need a lot of support to do it, but it is a big undertaking and you have to take care of yourself because you do it and everybody knows that they have made a really informed decision,
Yeah,
right?
of
Yeah.
course. And then, I mean, secondary to that, I can't help but add that Once you know these numbers, then it's absolutely imperative to plan for how to fund this in a way that makes sense for your longer term plan. Because if we are talking about long-term care, yes, you're saying people move, 80, 85, 90, but what about the cases where somebody lives for 15 years or 20 years? Those can be expensive.
Yeah.
And so not only do you want to be planning for the sort of lifestyle that you want to live, but also making sure that that money lasts. And so that's where the planning kind of goes back and forth.
Yeah. Yeah. I think just to make a point of that, so moving in at 85, it means they still have 10 or 15 or more years that they're living in that setting. So yeah, seniors are living a really long time now. We have lots of seniors that are over 100. It's not
Absolutely.
it's not a surprise anymore. So
Grandmother on the other side is currently 93, 94, and she told me she expected to die at 80. So,
yeah.
she's like, I don't know what I'm doing here. And so, like when it comes down to planning, you have to expect that you'll be here a little longer than you think, maybe.
I think you do. Yeah.
Yeah.
People are living a long time, and I think that's fantastic. So
Yeah.
you just need to have, our whole focus is to have good quality of life, right? And if they have a good quality of life, then the longer the better. So
Yeah, absolutely. Thank you so much, Kathy, for introducing me to Margot and Molly. It's too bad that they're missing right now, but
yeah, sorry, they're hard to contain.
yeah. Well, you got a cat and a dog and an open door. It's not like you're going to keep them in there.
Yeah.
But I learned a lot. I thought this is really, really helpful. Thank you so much. I know that there will certainly be at least a few people looking at their own long-term care, if not their parents and their families, and thinking about, how to prepare for that. We've got the animals on screen.
Chicken in their beds so that maybe they'd stay.
Maybe. Yeah.
Yeah.
See, I've got this bird interested in pulling apart the carpet and a couple treats, so we'll see what happens.